My name is Megan Allred and I'm doing the oral administration pass off. All right, so first thing I would do is go to my chart, my patient's chart, and go to his EMAR and find out what exactly he is scheduled for right now. And it looks like he is scheduled for atorvastatin and he is scheduled for 10 milligrams orally. So that's what I'm gonna go and get. I'm gonna go to our med cart, unlock it, grab it out. I'm gonna check. Atorvastatin, 10 milligrams, perfect. I'm gonna close the lock and lock it up. Okay. So then I'm gonna do my first check and check against his chart as well as what I've got. And it's atorvastatin calcium tablets, 10 milligrams, perfect. I'm gonna wash my hands. And then I am going to do the 6 patient rights, which is the right patient. And we've got Jonah Dinnerman. The right drug, which is atorvastatin. The right dose is 10 milligrams. The right route is orally. The right time, and it looks like it's due at 13:53, so right now. And then the right reason is for high cholesterol. So that's what we're gonna do today. I'm going to gather all my things. I'm just gonna double check to make sure he doesn't have any allergies to any medications, just to double check that, and he doesn't, so we're good. I'm going to gather all of my things and go to the patient's room. Hi, Jonah, how are you doing today? Oh, good, I'm so glad to hear that. My name is Megan and I'm gonna be your nurse for the day, okay? Okay, I'm just gonna close your curtain to give you some privacy. And then I'm gonna wash my hands. All right, Jonah, can you confirm your birth date and your full name? Great, that's just the person that I needed. How are you feeling today? Okay, that's good, good. So I just have some medication for you, okay? It's called atorvastatin. Have you heard of that before? Well, you might know it by Lipitor. Yeah, it's for your high cholesterol, okay? Great, okay. So we just have that for you today. I'm just gonna double check with my computer, atorvastatin, and an atorvastatin, 10 milligrams, 10 milligrams. Okay, so 10 milligrams is one tablet, okay? Is that usually what you take? Oh, great, okay. So now what we're gonna do is I'm going to scan your thing. And do you have any allergies that we need to be aware of? Oh, good, okay. Oh, except I forgot to press scan your patient. Okay, now we're gonna rescan you, sorry. Maybe. Okay, so we got the right patient, Mr. Jonah Dinnerman, and then we're gonna scan your drug, atorvastatin calcium. Okay, so that's our third check. All right, I'm gonna throw on some gloves real quick. So we are doing a tablet today, so that one you just can swallow it, okay? But if we were to do a liquid, I would make sure that I was at eye level when I measure it out. And if it was like a individual pill pouch, we would go to the patient's side of the bed to administer that one. But today we're just gonna do this. We wanna make sure we do one patient at a time, and then want to make sure that I don't touch any part of the medication. Okay, Jonah, I have a little bit of water for you. Do you need a sip of water before I give it? Okay, here you go. All right, ready? Here you go. Good. Okay, were you able to get that down okay? Oh, good, okay. Because we want to make sure that they swallow all of their pills. Don't want to leave anything at the bedside because then they might not know what it is. They might take it at the wrong time. A lot of different factors. So since he took it, I am going to do my dose, route, and time. And then I completed my 3 checks. I checked his ID. All right, and I am clicking administered because I administered it and he took it really well. So Jonah, some side effects that you might experience are headache and a little bit of nausea with this medication, okay? So if you have any of those, let me know. I will be coming back to check on you in about 30 minutes to an hour, okay? Okay, can I get you anything before I go? Okay, good. I'll be back in just a little bit, okay? So then at this time, grab all my supplies. And I would put my medication back in my med cart and lock it up. I would remove my gloves and perform hand hygiene. Okay, and for different medications, sometimes you do need to do vital signs before you give the medication. But he didn't need that for this particular one, so I didn't have to worry about that. I would make sure that there weren't any other nursing considerations to look into, and there weren't. So then after I had the allotted time of 30 minutes to an hour, I'd go back and check on him. Hey Jonah, how are you feeling? Oh, really, really sleepy? All right, well that's okay. Sometimes we feel that way, huh? Do you have any headache or nausea? That's great. That's so good to hear. Okay, well if you do start feeling any bit of weird symptoms, please let us know, okay? Okay, I'll give you your call light so you can call us if you need anything, and your water's just right here on your bedside table, okay? All right, we'll talk to you in a little while. So then I would just document any findings that I find and say that he was feeling good and that we are good to go.